Kidney stones. How do you avoid getting them, and how do you get rid of them?
So kidney stones very often they can be for a variety of different metabolic disorders, right? So it can be dehydration is a very common cause of it. So dehydration combined with maybe a slight metabolic abnormality where you're creating more calcium or oxalate in your urine can result in kidney stones. And so how can you prevent them? I mean, each person is individual. If you get a kidney stone, typically we do what's called a 24-hour urine analysis plus some blood work to assess what is the metabolic abnormality so we can target that either with diet or with medication. And so the kind of general recommendations for people who have kidney stones, one is increase your fluid intake to 2 to 3 liters. Again, the same number I told you before. You want to decrease your oxalate intake. Now, if you Google oxalate, you're going to find a million things that you eat that have oxalate in them. But the big ones are spinach and rhubarb. We're seeing a lot of nuts too that are, people eating a lot more nuts to get more protein. So, cutting back, it's impossible to get rid of all of that in your diet. But if you're having like a spinach salad every day, well, switch it to a different green, right? Don't eat spinach every day. Also, you want to increase your citrate intake. That's an inhibitor of kidney stone formation. So increasing fruits and things like that to increase citrate, vegetables as well. Actually, one easily accessible thing is Crystal Light. It has a high citrate composition, so you can drink Crystal Light with that 2 to 3 liters, and that can be helpful. You want to decrease your protein intake, so high levels of purines or purogenic meats like red meats and things can also put you at higher risk. So these are kind of the general sort of preventative measures we talk about for kidney stones. If you have a kidney stone, so a lot of times people can have kidney stones in their kidneys, they're not creating any problems, they're tiny, we can observe them over time. If they start getting very large or they are starting to move into the ureters or the tubes that drain the kidney, oftentimes they're accompanied with pain, quite a bit of pain, and it can be very uncomfortable. In those cases, if they're not having any infection symptoms, meaning there's no signs of a urinary tract infection, there's no fevers, no chills, we can treat it conservatively with pain medication. And also there are medications like Flomax, which we use for enlarged prostate as well, that actually relaxes the ureteral smooth muscle to allow the stone to pass a little bit better. If you're having an infection, you got to get it treated right away. You can get very sick very quickly. In fact, I've seen young, healthy patients, like they're healthier than me, walk in the ER with a kidney stone, and within 24 hours, they're in the ICU because they're really sick because of a kidney stone.
So
an obstructed,
fever, urinating, tea-colored urine, so meaning blood in the urine.
Yeah.
All of those are important warning signs that you ideally don't get to.
Yeah, blood in the urine, doesn't always mean infection. It could just be irritation from the stone, but certainly fevers, chills, or you have a sign of an infection and the stone looks like it's blocking. So if you get imaging and you see what's called hydronephrosis or pressure behind the kidney, and you have these signs of infection, we don't want to wait because you can get sick pretty quickly. And then, once to treat the kidney stones, there's 3 major options. One is shock waves. Another is ureteroscopy, where we go in with a camera and we have a small laser. We break it up into small pieces and take it out.
Where's the camera inserted? Through the urethra?
Correct. You're asleep under anesthesia, so you don't have to...
You saw that.
Yeah, I saw.
You saw the wince.
And then percutaneous nephrolithotomy, which is done if you have a large kidney stone or a very hard kidney stone that's up in the kidney. You can go in through the back with a small incision and with a specialized camera that goes in and uses ultrasonic lithotripsy to break up that stone and kind of suck it out that way.
These are extremely helpful.